everyone, and welcome back to Medigap Show. I'm your host, Holly Cohen, licensed independent broker and owner of MedigapCares.org. We're a nationwide agency with over 2 decades of experience with health insurance. We strive to help seniors unravel the complexities of Medicare every day. So today, we are diving into the whirlwind of Medicare news as we approach the 2024 election year, a period that often spells uncertainty, and especially Medicare.
Well, now let's talk about the Medicare Advantage landscape for 2024 and what it looks like. So here's 10 updates from Becker's Payers. More seniors and dual eligible individuals continue to enroll in Medicare Advantage plans, but the number of plans available decreased in 2024, according to an AHIP report published on January 9th. Here's 10 key updates about Medicare Advantage in 2024. More than 32 million people are now enrolled in Medicare Advantage plans, which is projected to exceed 34 million by the end of 2024. Among MA enrollees, 47% say they are in excellent or very good health compared to 53% of original Medicare enrollees. More than half of all people dually eligible for Medicaid benefits that means they're eligible for Medicare and Medicaid, are enrolled in Medicare Advantage, including more than 70% for those eligible for partial Medicaid benefits. About 38% of Medicare Advantage members have annual incomes of less than $25,000, compared to 23% of original Medicare enrollees of having annual income less than $25,000. Among those enrolled in Medicare Advantage, 54% are people of color. 4 million people living in rural areas are enrolled in Medicare Advantage. The number of plan offerings declined by 10% in 2024 to 3,665. Medicare Advantage plans will increase by an average of 5.1% in 2024, or $1.08. The number of plans offering $0 premiums declined by 13%. Medicare Advantage deductibles are increasing by 12.5% on average in 2024. The average DSNP, which is for Medicare and Medicaid dual eligible Medicare beneficiaries, their deductible on Medicare Advantage plans, which are called DSNP, is increasing by $47.04, though Medicaid programs pay for this on their behalf. Accounting for new enrollment, 13 out of 20 of the most popular supplemental benefits will be available to fewer enrollees in 2024. So basically what that last one is saying is that 13 out of 20 of the most popular, what have been called in the past extra benefits, those wonderful things that they seem to not want to stop giving away back in 2020, 2021, and 2022, that those are now available to fewer. 13 out of 20 of the most popular ones are now available to fewer enrollees in 2024.
They've been to the circus, you know what I mean? They've been to the puppet show and they've seen the strings.
More than half of the seniors are stuck in Medicare Advantage plans, as reported in Newsweek on January 11th, 2024. In 2023, more than half of seniors were enrolled in Medicare Advantage plans. For many seniors, the plans hid some serious problems that they only learned of later on. Seniors are routinely barraged with a range of Medicare Advantage ads, and they often sound too good to be true, boasting better prices and a wide range of services. Many seniors quickly decide to switch to a plan that saves them money up front. They're enticing because they do not charge premiums and include other services like dental care. Attorney Loretta Kilday told Newsweek. This simplicity and extra benefits prove to be a big draw, especially for people who do not have urgent health problems. KFF, which is the Kaiser Family Foundation, reported 9,500 daily ads for a Medicare Advantage during seniors' open enrollment period in 2022. And a survey by the Commonwealth Fund discovered 30% of seniors received 7 or more phone calls from Medicare Advantage salespeople for the 2024 coverage period alone. According to a Senate Finance Committee report by Oregon Democratic U.S. Senator Ron Wyden, customer complaints about Medicare Advantage marketing skyrocketed to double from 2020 to 2021, bringing the total to 41,000. Open enrollment meant the start of a marketing barrage as marketing middlemen looked to collect seniors' information in order to bombard them with direct mail, emails, and phone calls to get them to enroll, Wyden said in a letter to Centers for Medicare and Medicaid Services, CMS. While CMS responded by outlining new rules against Medicare Advantage plans, the organization did not ban list acquisitions from third-party Medicare Advantage marketing organizations, as Wyden requested. And still, health insurance companies spend millions lobbying lawmakers, with one report finding $33 million was spent by insurers in just the first 3 quarters of 2023. Some Americans might not even be aware of the difference between traditional Medicare and privately run Medicare Advantage plans due to how widespread the ads for the latter are. And I can just tell you, as an agent who has been doing this a very long time, working with Medicare and Medicare beneficiaries, that most people I do speak with that are new to Medicare do not know that there is a difference. That's the majority. And it's because of the misleading advertising that has been happening on television over the last few years. Those who do end up signing up for Medicare and don't realize they gave up the larger Medicare provider network and can no longer choose the doctor they like until it's too late. When you go onto a Medicare Advantage plan, it is a replacement for your traditional, also called original Medicare, which is a direct bill system. When you're on Medicare Advantage, it replaces that with a private insurance company with an HMO or a PPO network that you have to make sure your doctors accept. When you're on original, also called traditional Medicare, as long as your doctor accepts your red, white, and blue Medicare card, they will always see you. They will always treat you. Medicare, original Medicare, traditional Medicare will always pay for your medical services as long as it is deemed medically necessary by your provider. And as long as that provider, that doctor or hospital or outpatient facility or wherever you're seeking medical care accepts your red, white, and blue Medicare card, a Medigap plan, also called a Medicare supplement plan, which you can maybe identify by the letter, which would be a letter F. If you were born prior to 1955, you could possibly have that letter, or a letter G, as in George. That's the most popular Medicare supplement, also called Medigap letter at this time. Those letters, the Medigap, also called Medicare supplement, plans F, G, and there's one more letter, N. Those 3 letters keep you on original or traditional Medicare. And yes, they do cost extra. And that's why people get confused and they go on these Medicare Advantage plans, because Medicare Advantage plans typically do not have an extra monthly premium in addition to your Part B of Medicare premium. That's what always makes these plans attractive, and the commercials hype these up like crazy, as we've been talking about in this video. Now let's wrap it up here. Remember, Advantage plans are managed care, and you have to be willing to follow their rules. Stephanie Pogue, a certified Medicare insurance planner, told Newsweek. People usually get the care they need with an Advantage plan, but not always with the doctors or in the facilities that they want. Those who need expensive medical care in Medicare Advantage often have to wait for prior authorization approval, which adds an obstacle to their health care, something the marketers never mention. 1 in 5 seniors reported issues getting care due to the prior approval process, according to a recent retirement living study. Another study found half of beneficiaries switched to a different plan after 5 years. The marketing practices often go a step further when it comes to those eligible for both Medicare and Medicaid. Medicare Advantage marketers often neglect to explain that low-income seniors are also eligible for that program, which is more expansive and covers more health conditions and treatments, experts say. Chris Fong, the CEO of Smile Insurance Group, said that many of his clients were not even aware before signing up or don't even know that they've signed up for Medicare Advantage, which I can attest to. It happens in my office every single day that people don't know that they've signed up for a Medicare Advantage plan. A lot of the companies we have heard from come from clients who were called on the phone and convinced into enrolling, whether knowingly or unknowingly, Fong told Newsweek. Moving forward, he said there needs to be regulation to solve the problem. For now, seniors need to be on guard. When whenever they answer the phone. And by the way, when you answer the phone, make sure you know who you're speaking with, and you can ask for their insurance license. You can ask for what company they own or run, or you can ask for what company they work for. You can ask for which insurance companies they represent. You can ask anything you want because you are the consumer. The best advice we have is to make sure that you ask all of the right questions.
As we navigate Medicare news this election year, we're here to guide you. And if you found this information valuable, be sure to hit the like and subscribe button. Share with your community. Until next time, I'm Holly Cohen, and this is Medigap Show. Take care, and as always, be well.